So another common issue that patients with renal failure will have is they're going to have anemia because remember one of the functions of the kidneys is to make the hormone erythropoietin. Well, if you have decreased production of erythropoietin, you're often going to have anemia develop. So very commonly, we're going to give iron supplementation to dialysis patients. What we can do is kind of cool is we can actually give it via IV during their actual treatment, which is nice that we don't have to keep a peripheral IV in the patient for this, depending on if they can, because a lot of times they don't need to get this every single day. Things that you're going to want to remember is what are some good food sources of iron. Remember, there's the heme and the non-heme. Remember, again, we need vitamin C to help increase the bioavailability of that non-heme iron. All right, so then protein, you do have protein losses during dialysis. So therefore, once the patient is put on dialysis, he will need to increase the consumption. So before we said about how protein, we want to actually limit protein. Here we're going to, you can see we're not putting them on a lot of protein. 60 grams a day is not a lot. A key here is you want half of that protein to be what's called high biologic value. Remember, high biologic value means high quality protein because they produce less waste or urea. And you can see once again those examples are going to be animal sources or animal products plus soy. Soy is the one plant-based high biologic value, or it has all the complete, all the amino acids. Um, if you want the patient to have about 50 to 75% of their protein to come from high biologic value, that actually translates to about 4 to 6 ounces of meat a day. So even going to a restaurant and getting a steak, for example, you're already going to be way over 6 ounces for meat in most cases. So we're not talking about a lot. Even though we want 50% high biologic value, it's really not a lot. Some people on dialysis need to gain weight, so this is going to be very individualized. But you can see here for calories, we say we want about 35 calories per gram per day. These patients are going to need water-soluble vitamins, specifically the B6 and folate supplements are going to need to be used because number one, they have poor intake, and then two, these are commonly lost during the dialysis process. All right, now let's talk about kidney transplants. So kidney transplant is actually the second most common type of transplant. It can be a live donor or it can be from a cadaver. For nutrition therapy, we want to look at the patient pre-transplant. So these are usually not going to be an emergent situation. Like this patient's going to be on this transplant list for years. So we want to correct any deficiencies. You can see the more common ones are B6, folic acid, D, C, and iron. We want to correct any malnutrition. And we want this because remember, the patient who is in the best nutritional state is going to recover quickly or quicker after surgery. Because remember, they're going to have surgery when they have this transplant, and we know that's going to put them in a hypermetabolic state. All right, then you can see post-transplant here. Immediately after, they're going to be in that hypermetabolic state, so they're going to need to increase their calories. So they're going to be on a high-calorie diet for the first 6 to 8 weeks. And that protein restriction that they were on is going to be lifted. All right, now let's talk about acute renal failure, also known as acute kidney injury. This is going to be an abrupt loss of renal function. The patient may or may not have oliguria, which is when they make 400 milliliters or less of urine in 24 hours, or they may be auric, which is less than 250 milliliters in 24 hours. So it depends on what is causing it. So like decreased blood flow is going to happen usually because they have like a hemorrhage or they have some cardiac failure, they're dehydrated, there's some sort of obstruction of the renal arteries, or anything else that would decrease blood flow and lower the glomerular filtration rate. Damage is going to be, for example, nephrotoxic drugs or chemicals like you're learning in pharmacology. These can cause acute renal failure. Hypercalcemia or acute glomerulonephritis are also things that can. Obstruction is going to be anything that is blocking your excretion of urine. A patient can also have, for example, acute on chronic renal failure. For example, they have chronic renal failure and the patient's dehydrated or has an infection. And so the acute renal failure, remember, can be reversible. So we can get that back for a patient who has chronic renal failure, but any kidney function loss from chronic renal failure, we would not be able to get out. A big concern here is we have a concern for potassium retention because this can cause significant cardiac manifestations. You know, the dysrhythmias. Too much potassium and too little potassium is really a bad thing. So you can see because the kidney's not working correctly, we're going to start seeing things like their potassium, phosphorus, sodium, water, and their waste products all being retained. Their kidney's not going to be making that erythropoietin. So what are we going to do for nutrition therapy? Well, we're going to put them on a moderate protein restriction to try to minimize azotemia or nitrogen retention to make sure that the majority of protein is high biologic value once again. If oral intake is not possible, they may need enteral or parenteral feeding, which would be either through a tube feeding or through an IV. Once again, we may need to also limit phosphate or use those phosphate binders and get iron via IV. All right, so let's switch gears completely to a different type of renal disease, and this is going to be called kidney stones. As you can see here, the kidney stones can be present in the kidney, ureters, or the bladder. And you can read on your own, this is what the signs and symptoms of a kidney stone is. These are very painful if anybody's ever had one. All right, so we see that these are more common in men than women. Usually people who've had a kidney stone will have another one. The best treatment here is increased fluid intake. So we want these patients who have ever had a kidney stone, we want to encourage them to drink lots of fluids the rest of their life so that they don't have to have another one because they're at increased risk for having another one. We can also possibly do lithotripsy or surgical removal of the stones if sometimes necessary. But we're going to focus on nutrition. All right, so what are some risk factors for getting a kidney stone? Well, number one, dehydration. So if the solution is more fluids, well, then not having enough fluid is going to increase your risk. Because when you're dehydrated, for example, your urine is actually going to be more concentrated, so it's easier for those stones to form. You're going to want to assess for low urine output. It's often due to low intake. Infection. Damaged tissue and the changing of the urine pH provide an environment for those stones to develop. The middle of that stone might actually be bacteria. For obstruction, this is where urine stasis, so like slowing down of the urine, allows the solid materials to collect. This is also going to promote infection, which is going to worsen the obstruction. So once again, we get these deadly cycles where one makes the other one worse. Now, excessive urinary excretion of calcium oxalate or uric acid is also a risk factor for these stones. I hope you're clearly seeing that nowhere on here does it say excessive intake of calcium oxalate or uric acid is there. So we will not limit calcium intake in someone who has a calcium stone. We are going to focus on those calcium oxalate because as you can see here, 70 to 80% of kidney stones are actually going to be the calcium oxalate. The second most common there is going to be the uric acid. What we're going to do if they have a uric acid stone is to limit animal protein because it contains purines. We're going to put them on a low purine diet. Uric acid is formed in the metabolism of purine. A lot of times too, these patients might have gout, like the uric acid is for gout. All right, so here for example these foods have a high oxalate content. So we want to avoid those foods. Interesting, by boiling high oxalate vegetables, we can decrease the oxalate content. So for example, if we take that spinach and boil that spinach, we will dramatically decrease the amount of oxalate in there. We also want to avoid high doses of vitamin C because this vitamin is a precursor to oxalate. It is not anything, doesn't say anything about limiting vitamin C foods, but it's actually the supplements. We also want to avoid alcohol and caffeine because those are both things that are going to dehydrate someone. So what are we going to do for somebody while they're in with a kidney stone? Well, number one, we're going to make sure we're managing pain because these are very painful. We're going to make sure that we're having the patient drink plenty of fluid, as well as encouraging them to do, teaching them that that needs to be a lifelong. We can put them on a diet restriction of some of those stone-forming nutrients. So, for example, the low purine diet or the low oxalate diet. But we do not restrict dietary calcium. Make sure you understand that. We want them to actually eat foods that are high in potassium, as well as we want to lower the sodium in the intake. And then any type of procedures or tests the patient's having, we'd obviously want to do patient education for. All right, now let's talk about UTIs. So UTIs, the only way to treat and cure a UTI is going to be through antibiotics. But we can use nutrition therapy as a way to help manage it. So we're going to want to push fluids. We want to have them to take at least 3 liters a day if they're not on some sort of fluid restriction. And I've actually seen this do wonders. I've had multiple patients who we've done a UA, it's come back positive, they have a urinary tract infection. We put them on antibiotics, and within a couple hours, they're actually, like the patient was very confused, especially it was an older adult. And within a couple hours of drinking lots of fluids, the confusion was lifted. And so it was really, in that case, it was the fluid intake, not the antibiotics. The antibiotics would not work that quickly. So we do want to drink plenty of fluids. We want to have them avoid any beverages that can irritate the bladder. So carbonated beverages like soda, caffeinated like soda or tea, and alcoholic beverages are all going to irritate the bladder. We can also do this thing called the acid ash diet. This is trying to make the urine more acidic. So cranberries, plums, grapes, prunes, tomatoes, eggs, cheese, whole grains, meat, poultry are all example of foods that are going to make the urine a little bit more acidic, which bacteria has a harder time growing in. But again, the only way to actually cure is you need antibiotics. You cannot just drink fluids and go on this acid ash diet and cure your UTI. All right, then lastly, let's just talk for a minute about nephrotic syndrome. So you can see here, this is where protein is going to be excreted. It's going to end up causing hypoalbuminemia, edema, and hyperlipidemia. So what do we want to do? We want to make sure the patient's getting sufficient protein, not too much or too little. We want to put them on a low sodium diet so we can help maintain or help control the high blood pressure as well as edema. This might be even like 1 to 2 grams, like a really low sodium diet. And then we also do want to limit cholesterol and trans fat intake, and we want them not to get more than 30% of their calories from fat. And if you really look at all these right here, this really kind of explains this because they're having this hypoalbuminemia, so you want to make sure they're getting enough biologic value protein so that they can replace the albumin. If they're having edema, the big way that we manage edema is through low sodium. And if they're having hyperlipidemia, we're going to want to limit the trans fat, saturated fat, and cholesterol.